Good morning, students. I am Dr. Munpreet Singh, Assistant Professor in D.Y. Patil College of Physiotherapy. Welcome to my class. As you all know, I am first year BPTH coordinator as well as subject in charge of electrotherapy subject for first year BPTH. Today, in this class, we will be learning about physiotherapy modality which is used in electrotherapy, physiotherapy for treating patients with various conditions. So one of the modality among those is hot moist pack. So what we are learning today? We are learning a modality which is not cool or not cold but which is somewhat hot. Second is moist. What do you mean by moist? Is with something which is not dry but moist or wet, and packs which is given in a form of packs. Understood? So as we have elaborated the definition, not the definition but the heading of the electrotherapy modality, in further slides we will be learning more about this modality. If anyone has any doubt during the lecture, you can raise your hand and ask. So, before learning about this modality, every class has some learning objectives. Objectives are what this topic contains and what points should be cleared in the student's mind during the lecture as well as after the lecture. Now this lecture aims to brief the student about the following points. What are the following points? It are general principles of heat therapy, which we'll be learning now. Introduction to hot moist pack, physiological as well as therapeutic effects, methods of application, indications and contraindications, precautions and dangers. Now in this, method of application will be a practical aspect and will be much importance during your practical examination. Okay, make a note of this. So learning outcomes. Now what are the outcomes is at the end of this particular lecture or any of the lecture which will be conducted later, a student should able to explain these points. Which are these points? At the end of the lecture, this particular lecture, student should able to elaborate general principles of heat therapy, physiological effects of heat therapy, methods of application, indications and contraindications, precaution and danger. Everyone make a note of this. Now, why this is important is once you are able to elaborate all these points, that means you have fully understood the lecture. If there is any doubt or you are not able to elaborate any of these points, that means still you need some revision, still you need to ask certain points. Okay, so that the thing should be cleared in your mind. So take a note of this. I will give you 2 minutes to write all these points. Once you are done, please raise your hand. Done? Okay, we'll proceed further. Now, before learning about this modality in depth, we will be learning about general principles of heat therapy. Okay, as we have already learned in physics, what we have learned, if we start increasing the temperature of an object which have the tendency to change its structure according to heat, what will happen? Now if some solid is there, okay, now we'll take an example so you can understand better. Now if we are freezing something, water for example, in your refrigerator, it forms solid. The moment we start heating an ice cube which is in the solid form, and due to increase in temperature, it will start melting down and start forming liquid, and after that, if the heat continues, it start getting into gas and eventually it evaporate, okay, and again if you lower the temperature, okay, lower the temperature to a certain degree, okay, it will again start becoming solid. But we are not talking about any decrease in temperature, we are talking about hot moist pack. So hot moist pack is always be in terms of increase in temperature. So what we are expecting here, a solid will turn into liquid, will turn into gas. But now while we are learning about this physics concept in human anatomy, why? What is the reason of it? Now why we are learning this is all about the muscle tissue. Okay, a muscle tissue which has the tendency to elongate or contract. Okay, now what does it mean? Now according to this, if you see an object of solid, it has certain molecules which are closely packed to each other. Okay, that means they do not have any intermolecular distance between them to oscillate. Correct? That means they are closely packed together. Excuse me. They are closely packed together. They do not have any of the space to move. Okay? The moment we start increasing the temperature, and if the object has the tendency to elongate with increase in temperature, what will happen? These molecules will start, this object will start elongating. What will happen? This object will start elongating, and the molecules which are present close to each other start moving apart from each other. So what will happen now? These molecules will have some space to oscillate. Now oscillate means they vibrate in the given space, okay, at some given frequency. Understood? Now if we continue to increase the temperature, what will happen? Now the space which is there in the liquid, now again it will increase more, and now the molecules have more space to oscillate than the liquid stage. And as you all know, the next stage will be gas, where the molecules will form gas and go into evaporate or disappear into space. Understood this much? Anyone has any doubt? Anyone has any doubt? Oh, very good. Now, why we are learning this in physiotherapy? Why we are learning this in physiotherapy is only because now we are talking about human anatomy, and in that we are talking about a muscle. Now muscle has the capacity to elongate, as you all know, as you will be reading in anatomy subject, muscle has the tendency to contract and relax, and it also has the certain ability to get stretched. Now what will happen? Now if we talk about a muscle segment or a single segment, now muscle is termed as, again according to physics concept, is a solid form. Now I will give you an example. Now if you get an injury, okay, if you get an injury, now body's own mechanism is to do not promote that particular part to undergo any injury further. So what will happen? There will be a protective mechanism of the body which will not allow the body segment or part to move. Correct? Have everyone experienced this? Once you get an injury, you are not able to move that part, and it has undergone a lot of swelling, inflammation. So it is body's own mechanism or protective mechanism to do not promote further deterioration of the condition. Okay, so what will happen if the muscle do not now if I am doing a movement, that means elbow, biceps contract, this is bicep muscle, okay, biceps contraction is this, biceps relaxation is this. If I undergo an injury at the biceps, I will hold this position in contraction. So what will happen? Due to prolonged contraction, the muscle tensed up, okay, and it remain in this position. So what will happen? In a muscle, there are certain, now in physics there was molecules, in human anatomy there are tissues, okay, muscular tissues. In detail we will be learning when you come to the next year, second year, third year and fourth year. Now these are the basics concept, so in depth we will not be learning in first year, but the molecular physiology is there in this, but in-depth molecular physiology you will be learning in your second year, third year and final year. Okay. Now these are the basic concepts. So that is why in very basic thing I am explaining you all these concepts. So in muscles there are tissues which are closely attached to each other. Okay, which are closely attached to each other, okay, and our muscle has undergone spasm, okay, the muscle has undergone spasm. That means spasm is nothing but whenever there is an injury, the muscle is held in a position where it will not allow any further movement, okay. So what will happen during spasm? The tissues of our muscles are held together. Now remember, each segment or each particle of the human body require nutrient. Now you know, if we do not eat food, we will not have any energy to function. Correct? This is clear with everyone. If we do not eat food, we will not have energy to work. Same way, if the tissue will not have the energy, it will not able to work. It will not able to work. Correct? So how does this work? Now these tissues oscillate in all the direction, or to be more precise, they vibrate in the precise location. So once they vibrate, that means they are doing work, as well as if they vibrate in the said given frequency, they will ask for nutrient, and nutrient is supplied by the blood flow. Nutrient is supplied by the blood flow, okay, to the tissue. If there is adequate blood supply, the tissue will start receiving the nutrient. If there are decrease in blood supply, most of the tissues will not get the adequate nutrient and they will not be functioning adequately. Correct? Is everyone clear? Anyone has any doubt? Raise your hand. Anyone has any doubt? No? No doubt? Everyone is clear with the concept of physics, concept of human anatomy, concept of molecule, concept of tissue, concept of solid, liquid and gas. If anyone has doubt, please raise your hand. Yes, you can take notes in between if you want. We will be sharing the PPT at the end of the lecture. Still, there are certain points. Now these PPTs are in a form of bullet points. So the much of the things which I am explaining, you have to write it if you feel it is important. If you think you have to learn, so you write it down and take a note of this. Okay. Because once I share the PPT, most of the things which I am explaining now is not written in the PPT. So better to take notes and refer your notes as well as your book. Okay? Good. So now it is all about solid. Okay? It is all about solid. Now, once we start giving our therapy, that is, at the concerned muscle, we start giving hot, moist pack. Okay? Hot, moist pack. What will happen? Now, as I told, muscle has the capacity to elongate. Okay? Muscle has the capacity to elongate. Okay? The tissue has the capacity to change its structures with the increase in temperature. With 2 or 3 degree rise in temperature, muscle has the capacity to elongate. Okay? So what will happen? Once we apply hot moist pack, the muscle will start getting elongated. So what will happen? The tissue will start getting some space to oscillate. Tissue will start getting some space to oscillate, and with the oscillation, the structure which has gone into spasm will start decreasing, and the tissue which was deprived of oxygen, which is the major nutrient of a tissue, will start getting oxygen and will start working. And most of the tissue which was deprived of the nutrient will start getting the nutrient and will start working adequately. Everyone is clear with this? Now there is no concept of gas here. Okay, our tissue do not go into liquid to gas and they evaporate. It is not possible in human anatomy. It is a molecular form. I was taking just an example of an ice cube, but here it do not evaporate. It stays inside the body. Okay, so there is no concept. It is just for your understanding. I took this from the physics concept, but solid to liquid is from a muscle which has tissue, which is in the solid form. Solid form means contracted form. Here solid means contracted. Undergo some kind of relaxation so that intermolecular spaces increases and the tissue has the inner space to move in that particular part. Okay? Clear everyone? There is no concept of gas. Please take a note of this. Everyone take a note of this so that we can proceed further. Once you are done, please raise your hand. Done? Should we proceed further? Okay. Next step. Now, introduction. What do you mean by hot moist type? Every answer required some definition. If it is asked in during your examination, or it is asked as a viva, if an examiner is expecting from you that you should elaborate the definition of hot moist type, you should write the definition. You cannot directly write something about hot moist type without explaining about hot moist type. Okay? So, hot moist pack are a way of transferring heat to the patient by conduction. Okay? It is just a mode, as we cannot give heat to the patient without having some kind of things which are essential to transfer the heat. Okay? Now, one of the important things, why we do not use hot dry packs, why we use hot moist pack. The only thing, the best thing to explain this is, now as you know, now during summers, what will happen? You go out, you undergo excessive sweating. Okay? Once you sweat a lot and you do not drink adequate water, what will happen? You start getting heat burns. Correct? Everyone is clear? Now in this, why we do not now, a tissue contains 70% of water. A tissue contains 70% of water. Now again a concept of physics come into picture. You know about osmosis? Osmosis, yes, many of the people know. Osmosis, what does osmosis take? If you know concentration, the higher the concentration, lower the concentration, what will happen in osmosis? From water, from lower concentration goes to higher concentration, correct? Lower concentration से higher concentration में जाता था, सबको पता है? Yes, in the same way, if you give dry heat, the tissue will start losing its liquid, okay, and it start getting shrink. What will happen? Now 70% of liquid will start getting out and goes in a form of sweat in outside environment. What will happen? The tissue do not have the adequate thing inside it and the tissue will die. The tissue will die. And if we are giving hot moist pack, due to moistness, it will stop the particular tissue is in getting damaged due to continuous drying up, and it will maintain the health of the tissue. That is why hot moist packs are used. Now, hot moist packs are the way it is object, okay, which helps in transferring heat to the patient. Okay. Now, packs are immersed in an apparatus called a hydrocollator unit. Collator unit. Now, it do not get heat by itself. We have a separate unit called as hydrocollator unit, in which we immerse these pack and it gets heated to a certain degree which is ideal for the application. Okay, I have the photo, I will be showing you, okay, in the later slides. Now for now you should know these packs also I have a picture of packs I will be showing you. These packs are immersed in the unit. This unit is heated to a certain degrees, which is, and once it is fully heated, which is ideal for the application, we remove it and we apply. How to apply? Again, I will be telling you. Now, hydrocollator unit is used for heating the hot moist. As I have explained this now, it is a unit which helps in heating these packs. Okay, everyone is able to understand.
Anyone has any doubt, please raise your hand. No one? No one? You? No? Girl sitting in the last bench, you have any doubt? No? Should we proceed further? Okay. Now, what does these packs contain? Now, these are the fabric envelope containing silica gel. Why we use silica gel? Why we use? We can use any XYZ thing. Okay. Now, silica gel has a certain ability in which it absorbs the heat and able to retain that heat for at least around 10 to 15 minutes. So it has this special capacity to retain the heat. Special capacity to retain the heat for at least 10 to 15 minutes or moreover 20 minutes. Okay. Now this gel is contained in a set of separate fabric pockets. Now what does this mean? Now, as these are certain packs, these, as you can see, these packs are divided into certain pockets. It is not filled in whole of the pack. It is divided into certain pockets. You can see here. See, this is one pocket. This is one pocket. Okay. So like that, it is divided into certain pockets. Okay, which are separated from each other. Now, as silica gel has the capacity to absorb many times its own volume of water and when heated to give moist heat for 30 to 40 minutes. It depends how much you are heating the silica gel. Okay, ideally the heat comes for 10 to 15 minutes, but you can again heat the silica gel for around more in more increased temperature, and this can retain the heat for around 30-40 minutes. Okay. Now, packs come in various size and shape. Now, as the anatomy of body, all the anatomy are not of same size. Certain structure has different measurements, and certain structure are very small. So these packs come in various size and shape for easy application over different body parts. Now, these are the different size and shape. I want everyone to draw and note down how many centimeters are needed for these of the body part. Okay. Now, this is of standard size, which is 25 into 30 centimeter. Okay. This can be applied anywhere on the body, on your lower back especially, on your neck, or these are the standard size. Then this is of half size, which is smaller than this. It can be applied on the specific muscle if someone have tailbone pain or a small joint pain. So these packs can be used. Small joint means distal extremity, which are smaller than spines. Now, this particular thing is for your, this is of large size. It is of 25 into 51 centimeter. It is basically used for knee and shoulder. This is for cervical. Cervical means this cervical. Okay, and this is if you have to cover the upper back as well as the lower back at the same time, you can use this particular part. If whole of the dorsal lumbar fascia need to be heated, you can use this. So there are different shape and size according to the body adjustment. You can use these different type of hot wash pack. I want everyone to draw these diagrams on your books. Write down different measurement, okay, of these packs. Once you are done, raise your hand. We will proceed further.
Fine. Should I proceed further? Draw the neat diagram. Just do not write anything. Draw the neat diagram as you should be able to understand what you have written later. Correct? Should we proceed further? Raise your hand. Up. Next. Now, it is all about a unit which store your hot moist tank. How does this unit looks like? It is a stainless steel tank. Okay. Now, I have a picture of it. This is an hydrocollator unit. It is of stainless steel. It has racks. Okay. It has coils which help in heating of the water. Okay. These are the wire racks. These are responsible for separation of each hydrocollator unit. These are the some hot hydrocollator units have hangers over here which can be used as for hanging the hydrocollator unit. And this is the closing. This is of closing which helps in closing the. This is the cap which helps in closing the hydrocollator unit, because the water gets heated and this has a tendency, water has a tendency to evaporate. So to stop that, it has been covered using this. Okay. Now it is of stainless steel. It contains silica gel which are heated, as I already explained this. Now have insulate bases. The large machine be insulated with fiberglass. Now, as we are dealing with something which use electricity. Now, if there is any kind of leakage, okay, of the current, what will happen? The particular part will start giving shock, and we do not want any of the therapists to undergo any injury. So to stop that, the particular area is insulated. All the areas are insulated, so that there should not be any leakage of the current. Okay. Now, as I already the unit contain a wire rack which acts as divider for the pad and prevent contact of the pad with the bottom of the tank. Now, as I already told, the rack serves as a separation of individual pads from each other, as well as it do not allow the pad to touch the bottom. Why it should not be touched at the bottom? Because the heating coils are present at the bottom of the tank, and because they are continuously giving heat or getting heated, it can damage the pad, or the pad can get damaged or teared up because of excessive heat. Okay, if you want to write this down, you can write. Okay, move to the next class. Next slide. I will be showing you this hydrocollator unit. This is there in our physiotherapy department. Okay, when we will start with practical demonstration, at that time I will be showing you how a hydrocollator unit looks like. For now, you can just draw the diagram, and you should know where the racks are, where the coils are. Okay. So, next is all about physiological and therapeutic effects. So, physiological and therapeutic effects we will be covering in our next class. Okay. Till now, if anyone has any doubt, please raise your hand.
CR, please take the attendance of the class. Raise your hand if anyone has any doubt. Okay, thank you everyone.